Good day. My name is Steve Selbst, and I'm a Quill Healthcare consultant, and I would like to introduce my colleague, Ms. Regina Vasquez. Between us, we have over 30 years of healthcare consulting experience, and we specialize in a variety of services, including payer contracting, analysis and negotiations, credentialing, and marketing practices services to payers and employer groups, and most recently, online marketing services. Between us, we have negotiated over 10,000 payer contracts. Today, I am pleased to welcome you to our Quill Healthcare 11th monthly value-added webinar for practices. Quill Healthcare is the leading seller of medical supplies and office products and is dedicated to providing you with useful content in these webinars as a value add to your practice. Today's topic, Move the Needle Up, how great patient experience can earn big payer bonuses, is presented by Ms. Meryl Llewellyn, who is the CEO of the Sullivan Llewellyn Group. This webinar, I'm excited to report, has been approved for CEU credit through several associations. Please check your email account within the next business day following this webinar for details about receiving your certificate for credit. Before we begin today's session, I would like to cover a couple of administrative matters. First, in order to participate in the session, which I highly encourage to make it interactive for all, there are several ways, or actually two different ways that you can go about participating. First, if you'd like, you may send an email at any time beginning right now to info@healthsense.com, and we will gather all of the questions that you ask. And during pauses in the presentation, Meryl will be accepting and responding to any questions that you, the audience, may have. Additionally, you may go ahead during these breaks, and I'll remind you about how to do this, and simply press *6 on your phone to free up your phone line in order to participate and ask a question. And then when you're done asking your question, please press *6 once again on your phone. So two different ways to participate and ask questions. Simply send emails to info@healthsense.com as described here, or at the time that we open up the session for questions and answers, press *6 on your phone, ask your question, and press *6 again. The other item I'd like to cover is what happens if ET loses contact with the home planet. In other words, if you can't any longer view the webinar, what do? You just go right back to join.me/quillwebinar, and you'll be instantly restored into this session, and you may simply dial back into the conference information and the conference line, and you'll be connected right back in as well. Now, without further ado, I'd like to introduce our distinguished guest speaker, and that is Ms. Meryl Llewellyn is our guest speaker today. Ms. Llewellyn is a 20-plus year patient experience consultant. And in fact, that's what today's topic is going to be all about, is patient experience and how to improve it. She is a regular speaker for medical associations, prominent associations such as the MGMA, at both the national and state levels. She and her partner, Kevin Sullivan, developed a patient satisfaction survey system that is currently used by hundreds of practices nationwide. And this is to help clients to boost patient survey scores, to increase patient compliance, and obtain pay-for-performance bonuses. She and her company work with practices to implement service quality initiatives that improve the service and performance of physicians and staff members alike. Physicians and administrators who are upset with low patient satisfaction scores often turn to Ms. Llewellyn and her team for help in identifying the doctor's limitations and ways of improving, and she will make recommendations that are specific and result in that improvement. As a professional shadow coach, Meryl has helped hundreds of grateful doctors throughout the country move from the bottom to top quartile in their survey rankings. Sullivan Llewellyn, Meryl's company, is also an MGMA AdminiServe partner for patient satisfaction surveys and customer service. Now, I'd like to turn the floor over to our guest speaker, Meryl Llewellyn. Meryl, take it away.
Thank you, Steve. It's delightful to be here. And what we're going to talk about today are the following three things. The first is, what is CMS, the Centers for Medicaid and Medicare services, what are those bonuses that you're hearing so much about? Secondly, we'll talk about what survey scores predict the highest outcomes. In other words, what questions on your survey, if you were to improve, what would that lead to in terms of the bigger bang for your dollar? And then last but not least, what are the specific strategies that you can use to ensure that you've got the highest ratings and therefore you have the best chance of getting those patient experience bonuses? So let's begin a quick review, very, very brief review of the Affordable Care Act, which is also known as the Triple Aim. Now, the Triple Aim says it all. The government, in its wisdom, has decided, and not without some discussion, to ensure that the healthcare providers of this country focus on improving the outcomes. In other words, CMS wants to get the bargain, the value for the money they're spending. And how they are judging that is improved outcomes at lower cost, and you know that there's a whole focus on reimbursement. All of that, improved outcomes, lower cost, resulting in better patient experience and engagement. And by the way, engagement and patient experience and engagement are not necessarily synonymous. Patient engagement means that patients are totally involved with their own health. In other words, they take responsibility for their health. And oftentimes that is very dependent on how they relate to their providers, their physicians, and also the other members of the care team. So that's what's going on. Now, the question, of course, is how is CMS determining better outcomes at lower cost? Well, you're all familiar with how you are using your EMR to track patient outcomes, whether or not patients are adhering to their medical regimens and having lower HbA1c scores and so forth. We focus, Sullivan Llewellyn Group is non-clinical. We focus on the patient experience element because CMS is conducting surveys measuring the patient experience. Now, what the survey looks like that you don't have to use now, but you will at some point, it's called the CAHPS survey. You've probably heard that acronym. It stands for Consumer Assessment of Healthcare Providers and Services. Now, there's a letter that comes in front of that called the HCAHPS, which is mandated currently by hospitals. They are required to conduct this survey, the hospital CAHPS survey. And by 2017 or 18, the government is likely to mandate it in the clinician group environment. Clinician group applies to 2 doctors. Right now, it's not applicable because most practices are too small, but it will be required by 2018 in all practices. And here's a look at what the survey is measuring, and this is 2 or 3 pages here I want to share with you. First, the questions are about your provider and your care that you receive from the provider. So let me show you on the next page what specifically the CAHPS survey is designed to measure. It says, for example, in number 16, in the last 6 months, how often did this provider explain things in a way that was easy to understand? Now, let me just share with you something. All of you who have conducted surveys in the past, most surveys, and including MGMA survey that we developed in conjunction with MGMA, the rating scale goes from excellent to very good, good, fair, poor, because it's a perception survey. CMS is now beginning to look at what's called an experiential survey, asking the patient what did they experience. And you'll notice the rating scale is quite different. Look at, for example, number 19. In the last 6 months, how often did this provider give you easy to understand information about your health questions and concerns? And here are the ratings. Never, which is a horrible thing, never, sometimes, usually, always. And just so that you know, in the hospital environment, Only the always scores qualify for the bonuses. In any event, you can see that these are all having to do with physician performance. The next one over on the other side, number 22, how often did the provider show respect for what you had to say? Now, you heard Steve say that I am a shadow coach, and I have shadowed many, many physicians. And it's interesting to see how physicians perceive patients' respect for them. They assume that if the patient shows up on time and sits meekly in the office and listens to what the doctor has to say, that's showing respect. On the other hand, patients judge respect demonstrated by the physician as to whether or not the physician is actually listening to what they have to say, and whether or not they are acknowledging what they have to say, and whether or not they're even showing empathy for what the patient has to say. And oftentimes, those two perceptions of respect are a little bit different. They're really in opposition to one another. We'll talk more about this as we go along. Number 23, how often did the doctor, provider, spend enough time with you? Another interesting thing, patients perceive the doctor spending time when the doctor sits down, looks interested, does not have a hand on the doorknob, but more than anything else, asks, have I answered all your questions? So we've got some strategies that will help you max this. The last part of the survey deals with the care team. And it's interesting, and I've talked with somebody who developed this survey, and we are stuck with the nomenclature here. Clerks and receptionists at the provider's office. Why it doesn't say nurses, I don't know, but it's pretty much cast in concrete. But in any event, in the last 6 months, and I'm on number 42, how often were the clerks that you can read as nurses or medical assistants and receptionists in the provider's office as helpful as they thought you should, as helpful as you thought they should be? The word helpful is very instrumental here. We've got some strategies for you that will help to improve your scores. And then, of course, another one, courtesy and respect. So those are the areas that the government, the Medicare, is looking at, and you can be assured that if Medicare is starting out measuring these things, the private payers are not far behind. And all of this leads us to our first question, okay? Right now, is your practice currently getting patient experience bonuses? Are you submitting any of your information to Medicare? Steve, do you want to announce how to answer this?
Yes, thank you, Meryl. Okay. And as Meryl indicated, this is an opportunity to participate, and all responses to this question are anonymous. We just simply aggregate the results and show you a bar chart. So go ahead and go in your favorite browser, or even on your phone for that matter. You can simply go to www.healthsense.com/Q1. That's www.healthsense.com/Q1 at this time, and go ahead and answer this question. And I will review the results as soon as you have an opportunity to answer. So by way of illustration, I will fire up a browser and show you where it's at. So let's go to www.healthsense.com/Q1. Get it in there. There we go. And you will see the question. Simply pick your favorite answer and click Done when you're completed. And it looks like we've had several responses. Let me refresh here. There we go. Actually, there are 8 reporting, so let me go ahead and pull up the results. There we go, Meryl. Looks like an even perfect split here. So I'll turn it back over to Meryl to describe the outcomes.
Well, thank you. And as you can see, as Steve said, of the total, 4 said yes and 4 said no. That will change in the future because as reimbursement goes down or is dependent on value, the next thing is for people to demonstrate superior quality, clinical quality, and superior patient experience. And that's how you'll make up for the shortfall, which is, I can tell you now, if you haven't had pushback from your doctors, that's in your future. The gentleman that I shadowed last Friday was adamant that this whole business of patient surveys and patient experience was all, as he put it, a crock, and that after all, the only thing that was important was the quality of the outcome. I had a real tough time shifting his thinking over. And Steve, if I may, can you tell me how to get back to the, there we go. All right. If you'll put us back on the main page, that's wonderful. Thank you. All right, moving on. So, what are the ways that you can improve your survey, your patient experience survey scores? Well, let me set the stage. First, I want to explain to you the word outcome here is not a clinical outcome. It's a phrase that describes these two areas of study. Patient experience is based on one outcome, which is overall satisfaction with the practice, and the other is, and this one particularly for primary care, is your bread and butter, and that is recommendations from satisfied and eager current patients. So we're going to look to see what it takes to improve these two key outcomes. But the first thing I want to tell you is that you could look at a patient survey, look at your lowest scores, and say, this is what we have to fix. And from experience as the MGMA survey, preferred survey vendor, and all of the other clients that we survey for, the most frequently mentioned, there are two typical low scoring areas. The first is parking. Many, many, many practices have problems with parking. And the other is wait times. And if you spent a lot of time saying we've got to improve parking, you could spend a lot of money, and that may not be the source of the biggest irritation of patients. They may rate you low, but that may not be the one area that, if you focused on, would give you better scores. So what we have done with our databases, and we have two basic databases, one is primary care database, and I'll explain more in a moment, and the other is the specialty database. We performed what's called a linear regression analysis. Now, why bother? Well, the first thing is that when you correlate the high scoring questions with which of those questions was most frequently mentioned, you can determine which of the survey questions, survey items, is the predictive of the two key outcomes we just referred to. That tells you whether or not to focus your efforts on the lowest scoring or on one that may not be the lowest scoring, but if you could improve it just slightly, it would give you an overall greater sense of satisfaction or a greater willingness to recommend. So the bottom line is, using evidence-based information that I'm going to share with you, you can focus on the initiatives that will have the highest impact in boosting your scores. So let's quickly review again what the two outcomes that we have identified as being those that are the most important for a successful practice. Overall satisfaction and would recommend the provider. So here we go. What does this all mean when you come right down to it? Well, as I mentioned to you, we have divided our databases into two sub-segments. Primary care, that contains 467,000 plus individual patient responses. And in the primary care database, there are general family practice, internal medicine, pediatrics, and OBGYN, okay? So when we we performed this linear regression analysis on the primary care database, this is what came up first of all. Overall satisfaction with the practice. These were the items that were you to focus on would give you the biggest bang for your buck in overall satisfaction. Signage, helpfulness of receptionists and office staff, overall comfort, taking time to answer your questions, and thoroughness of the exam. Now, they are color-coded so that as we go through the subsequent list, you'll see the commonalities. So, if you're a primary care practice, these are the top 5 things to work on to boost your overall satisfaction with the practice and willingness to recommend. Overall satisfaction. For recommend the provider to others, again, primary care database. Helpfulness of the receptionist, we've heard that one before, haven't we? Here's the first time waiting time in the exam room. Exam room, not reception area, exam room. And by the way, if you've tuned in to a program I've done before, or you've ever seen me speak, you know I am absolutely deaf to the word waiting room. Never refer to it as the waiting room. Call it the reception area. It's much nicer. Don't remind patients that they're going to wait, okay? Getting care as soon as you need it, knowledge of important information about your medical history, and helpfulness. Again, we see helpfulness. Now, let's move over to the specialty database. And the specialty database is larger, but that's because we have even more opportunities for patients to respond. Why? Because we have cardiology, orthopedics, endocrinology, rheumatology, urology, neurology, you name it. All of the specialties are in this database, and it's close to 500,000 individual patient responses. So let's see what it would take if you could focus on just 5 things if you wanted to have overall satisfaction with the practice. In a specialty practice, what would you look at? Well, here's that friend again, that helpfulness of the receptionist, signage, answering questions in a way that was easy to understand, helpfulness, and I'm sorry the word understand picked up the blue for the next one, helpfulness of people who assisted you with billing and insurance, and willingness to listen. Last but not least, and by the way, you'll see all of these side by side in a moment. Last but not least is, would you recommend the provider? Once again, it's waiting time in the exam room, helpfulness, knowledge of important info from your medical history, answering your questions in a way that was easy to understand. And don't forget, these are specialists, and specialists have oftentimes more medical terms than the average primary care doctor, and willingness to listen carefully to you. So let's look at all 4 of these side by side, okay? You can see the commonality. Interesting, for overall satisfaction with the practice, signage is a big deal, both for primary care and specialty. And it's especially important if your patient if you're a specialty practice and your patient has been referred to you by the primary care doctor, if they can't find you, or the primary care doctor who set the appointment for you didn't tell the patient how to get to where you are, and your signage is hard to see. And believe me, I don't recall if Steve told you, but I'm also a professional mystery patient. I've been in more practices as a, quote, faux patient, a fake patient. And if you assume that people know where you're located because you've lived in your town a long time, but a newcomer may not know how to get around, and it can be very frustrating trying to find your location. Now, if there's one that you can see is common to all outcomes in both primary care and specialists, and that's helpfulness of the receptionist office staff. So I wondered what, if you didn't have a whole lot of money to spend, what would you choose as your first priority, okay? Anyway, let's take a look at all of these before we go further. Let's see how many of you are conducting a formal customer service initiative.
Okay, and just as before, to participate in this anonymous survey, simply go on your browser to www.healthsense.com/Q2 at this time.
And remember, the reason that we're asking this is because helpfulness of the receptionists and others in your practice is so important. Let's see how many of you are actually conducting a customer service training program or a service quality initiative.
And if you are conducting either a formal training program or initiative, please answer yes. And if you're not, please answer no. And click done again at healthsense.com/Q2 as you see it here. And I will toggle back to the survey. And it looks like we do have 8 responses in, and even 8 just like before. So let's take a look at what we have, Meryl.
All right.
And here we go. This time we have a little bit of a dispersion here.
Excellent. Well, you can see that more people have gotten the message about the importance of staff and provider courtesy, helpfulness, and so forth. So as we go through our rest of our session, I'm going to give you some suggestions as to what you can do to either augment your service initiative or to use as strategies to kind of kick one off. So the bottom line, of course, is what does this information that we've just shared with you, what does this mean for your practice? Well, this is where we need to focus in terms of what do you currently think is the most important aspect of your service improvement? Are you focusing these days on wait times or courtesy, provider-patient communication? And you know how to do this now. You click on the HealthSense, or you could click on that, or better yet, I guess you can't click on it. Type it in and do /Q3 and choose which of those you are focusing on most.
And this will be the final opportunity to participate in the survey anonymously. And we'd really appreciate it if you would, one more time, in your favorite browser, go to healthsense.com/Q3. And at this point, you know the drill. So simply go to healthsense.com/Q3 and we'll tabulate the results momentarily. Well, we have 2 more to go because last time we had 8 participants. We only have 6. So for the 2 that haven't participated, I'll wait another 10 seconds and see if we can get you in there. And again, this is anonymous, so please don't worry about us keeping track of who you are. We don't do that. We're just aggregating results here. All right, thank you.
And by
here
the way,
we go.
Yep.
All right, and a little bit of a disparate set of results here too, Meryl, if you want to go ahead and explain.
That's amazing. First of all, it's wonderful to see the provider-patient communication is the focus, the majority focus, because that's what makes or breaks your practice. In addition, however, staff courtesy, and I'm glad to see that others are doing that as well. Staff courtesy, the two components of your care team make or break your practice. So from now on and through the rest of the webinar, we're going to be giving you specific techniques based on what the linear regression analysis indicated. We'll give you some specific techniques, but in particular, it will be in terms of physician and care team performance. All right, so here we go. Those of you who are madly copying down the color-coded strategies, here are the top 7 most predictive of key outcomes. There were some, by the way, on the previous slides. There were some that were in black that only appeared one time, so those do not appear here. These are the ones that were most frequently mentioned, and by the way, they are not in priority order, okay? But they were mentioned most often on the primary care and specialist practices. So, with that in mind, let's get started. Sullivan-Llewellyn has an acronym or a model for putting everything into context. It's very easy to remember, and what we will do is indicate what your strategies are under the letters in this acronym. And of course, the acronym is clear because any kind of service, the need for service is clear. Delivering good service is clear. It just seemed to fit. And the C, of course, stands for connect. And how your care team, whether they're billers, whether they're receptionists, whether they are physicians, how they connect with patients is so important and memorable to patients. The L, of course, is listen, and how physicians and others listen to the patient, how they communicate their listening. And in this environment, with the EMR coming between the doc and the patient, at least that's what the doctors think. And again, my shadow coach E last Friday was just adamant that he was being rated down because it wasn't his fault, it was that he had to do all this work on the computer. I'll give you some suggestions how you can offset that. The E stands for explain. And anytime you or I have gone to the doctor, if you're not certain of what's going to happen, you feel almost as if you're vulnerable unless they explain what's going to happen next, how long it's going to take, etc. The A is ask, and there are certain questions. And remember our friend helpfulness? Asking certain questions certain ways certainly conveys that you're interested in helping people. And then the R is reconnect, and there are times when patients need to be reconnected with. This came about because as a mystery patient, and you may be aware of this yourselves, is when the patient arrives at the practice, everybody is interested in them because there are certain processes you have to go through, procedures to register them and to get them into the room, etc. So a new arriving patient, everybody is giving them attention. As the patient departs, typically the receptionist at the front desk is focusing on newly arriving patients, and the departing patient is almost invisible. So we suggest, and you'll see this again in a little bit, the importance of reconnecting with patients as they depart. So this is the model under which we will be putting in all of the strategies that will help bolster your survey scores. So let's begin. Under connect, remember we talked about signage, clear, visible, accurate. I can't imagine you wouldn't have an accurate sign. On the other hand, signage, what comes under signage are posters. And look around your reception area and in the exam room. Are your posters, your notices, are they up to date? I've been in practices where something is put up to alert patients to some new opportunity or new service or whatever, and it's dated in I keep saying 19, I'm not really stuck in the last century, but it's dated, let's say, 2013, and here we are at 2015. It kind of undermines my confidence in a practice to see signs or posters that are difficult, either A, to read, or B, out of date. And by the way, be careful of what your sign says, all right? What if you are going to a practice and it says surgery parking only, 5-minute limit? How fast is this cataract physician, this ophthalmologist? Does he go in like Zorro, zip, zap, zap, and you're done? So again, that is not exactly a very welcoming sign. Look to see how welcoming your signs are. Here's one that I think is very good. This happens to be from a physician up in Concord, California. I like the fact that it says, thank you for your patience. The doctor will be providing you the same level of personal care and service, professional care that he's providing another patient. So that doesn't absolve the doctor from running behind. On the other hand, it certainly acknowledges that patients might have a bit of a wait, and the doctor wants to reassure them that he is worth the wait. If you have a sign, as I was in an office not too long ago, that said, if you've been waiting more than 30 minutes, in the old days, some of you remember, it used to say 20 minutes. If you've been waiting more than 30 minutes, please come and tell the receptionist. I find that so offensive, A, because that says that it's likely I'm going to be waiting more than 30 minutes, and B, it's not my job to tell you you're running late. It's your job to tell me that you all are running behind, and apologize and ask me if I can wait or would I like to reschedule. Connecting also includes the schedulers. Always ask, do you know where we're located when you're connecting? Receptionists, welcome to new patients. Acknowledge the fact that I've not been there before and you're happy that I'm part of the practice now. Welcome to our practice. And by the way, if I'm the second person in line, and of course these days some of you probably recall, you have it in your office, the sign that says wait here, which is usually about 5 or 6 behind the reception area, look out. Ensure that the receptionist looks out and acknowledges that I'm standing there. All she has to do is say, thank you for waiting, I'll be with you momentarily. Okay. Billing staff, how do you connect? Be certain the person says, I'm Mary Beth, I can help. Okay. Be cordial. I recognize that billing can be very challenging, particularly if you're doing collections. But there's no need to be so professional as to sound cold and inhuman almost. Okay? What about the docs? How do they connect? Doctors, when they walk into the room, regardless if they are running on time or not, they should get in the habit of saying, thank you for waiting. Thank you for waiting. And the patient will say, oh, I wasn't waiting long. And a doctor one time said to me, oh, I know you weren't, but sometimes I am late, so put this one in the bank for next time. I mean, use it as an opportunity to show respect for the patient. Everybody, okay, smile, and certainly wear name tags. But it's not just wearing the name tags. Wear the name tags clipped up where the patient can see them. These days, the majority of practices and hospitals wear the name tags that are on necklaces or chains or what I call a lanyard, and they float freely and turn around so that it's very challenging for the patient to see who it is that they're dealing with if you don't introduce yourself to begin with, but wear the name tag clipped higher up so it doesn't flip. And what about listening? Remember the old respect thing? If I come in to talk with you, please at least give me eye contact so that I know for a fact that you are paying attention. And yet, many practices, the medical assistants will look at me, ask me a question, like, for example, when was your last tetanus shot? And as soon as I answer, they are looking at the EMR, and then they are prompted by the EMR to ask the next question. And they continue to look at the screen while asking questions. That's never a good idea. If you're going to do that, say to the patient, I'm entering your information into your record, but I am listening, okay? But whenever you ask a question, always give eye contact. And then, and this goes in particular for providers, but everybody, if I come to you and I say, you know, today my throat is hoarse and I think I'm losing my voice, and tomorrow I have to give a presentation. Instead of saying, which 90% of the people do, they'll say, oh really, when did it start? That's the first thing they always say, when did it start? Anybody else in the house sick? Instead, they should say something empathetic like, Oh, I can imagine that's got to be frustrating for you. Or they could say, oh gosh, yeah, it's got to be tough. Let's see what we can do to help you out here. Something empathetic. Here are some of the things that you can say. Gee, I'm sorry to hear that. If a person comes in and says, I tripped on a curb and my ankle is really, I think it's swollen, might even be broken. First thing to say is, I'm sorry to hear that. Not, how did you trip on the curb? People don't want to hear the solution until they hear the caring in your voice. Then they want the solution. Another thing that's got to be tough or frustrating. Okay? There are some people who come in who, depending on the specialty, or maybe everybody, your first thing is, if you've had an ongoing chronic pain or condition, first thing you think is it's going to be cancer. So if I come in and say, I've had this funny feeling in the back of my throat, and it's been going on for 3 weeks, it could be nothing. It could be allergies. But to say, I can understand why you'd be worried, but it doesn't look serious to us or to me. Okay? Now, a sign of empathy really it establishes such a nice connection with patients. But I'm not going to tell you to go over the line, because there are some docs who might think that this would be the right answer. I think you'll find I'm one of the most empathetic doctors around. I'll give you a chance to look at that slide. And I will tell you that about 4 years ago, my partner and I went to Saudi Arabia. Believe it or not, Saudi Arabia, in a town called Dhahran, was very interested in customer service. And when I tried to show this slide, they wouldn't let me. They're very, very modest in Saudi Arabia. What about explain? What is it you need to explain? Well, certainly, receptionists tell patients what to expect. I remember going into a practice here locally in San Diego. It was an OB practice, and it was a mystery patient. And I went up to the counter and I said, as every woman does when they go to the OB, is the doctor running on time? And this woman looked at me and she said, oh, we never know. The only way we know is if there are no complaints. So far today, no complaints. I guess he's running on time. And that's not exactly what you expect to hear. And yet, there are some practices that say, but the patients show up late. That's why we run late, because the patients show up late. Well, let me suggest to you that that is something that can be fixed, okay? Oftentimes, practices ensure that patients run late because they've been trained to run late. If your doctor is chronically late because he or she shows up late in the morning or does not manage the time with the patient very well, then the patient knows the doctor's always a half an hour late. Why should I come on time? Because I'm going to wait a half an hour. So they deliberately come behind, which of course makes the doctors crazy. Here's what one practice did to me when I called to make an appointment. The receptionist said to me on the phone as I was making the appointment, Dr. Jones, Dr. Jones likes to run on time. And if you're going to be more than 10 minutes late, we may have to reschedule you. Well, that told me right off the bat this doctor likes to stay on schedule, and so I made it a special effort to get there on time. And in the exam room, not in the waiting area, not in the reception area, but in the exam room, there was a poster that said, Dr. Jones, for your convenience and the convenience of others, likes to keep to the schedule. If you're going to be more than 10 minutes behind, we may have to reschedule you. I think that's a great idea. If you want to run on time and your doctor is determined to stay on time, then tell the patients. They will appreciate it. However, if a patient does show up and the doctor's an hour behind, ask them if they can stay. And if they say no, say, we can reschedule you. Give them the option. Leave patients in control. Now, regarding explanations with the billing staff, plain English. Don't talk about pre-auth or EOB or any of those other phrases that people, even now, value billing means nothing. So not that you, as a billing person, would say that, but just be careful of the jargon that is used in the financial part of the business. Medical assistants, when you pick up the patient, unless you've known this patient a long time, introduce yourself and make a little small talk as you go down the hall and tell patients what will happen next, okay? The one thing I remember as a patient in a urology practice, the woman stood in the doorway, called my name. I got to the doorway, and in very loud language, she said to me, "What's your DOB?" Now, I happen to know that meant date of birth, and I was kind of offended that in public she would ask, what was my date of birth? I'm thinking, could she have whispered it? And why did she need to know it? It should have been on the paperwork. And then as we walked down, this is a urology, we're walking down the hall, she hands me, which she had in her hand when she beckoned me, she hands me a cup and says, "Can you give me a sample?" I thought to myself, I don't even know this woman, and she's asking my date of birth and whether or not I can. I just found that to be so off-putting. What she should have done was to make a little small talk and then say, and now we'll need a little specimen in order to do some tests to help find what your problem is. I mean, a little social, a small talk makes all the difference in the world. And for providers, of course, the same thing. Do not tell the patient, as I heard one doctor say, we're going to titrate the medicine. Another doctor, and this was a podiatrist, said to a patient, "Oh, you have an innocuous condition." Now, we all know what the word innocuous means, but I'm not sure every patient does. So, docs, please use simple terms. Ask. What are the things you ask? Well, first of all, when the medical assistant is departing the exam room, why not, if you want to improve those scores, say, is there anything I can do to make you comfortable while you wait? One of our clients has an offer of, can I get you a small bottle of water while you wait? Okay. Another client says, is there anything else I can do for you? Well, this is, I do for you to make you comfortable, but another said, anything I can do for you while you wait, okay? Receptionists always say, may I help you? Typically, and you may or may not be aware of this, but typically when you come into an office, I have found as a mystery patient, they will look at you and the first thing they say is, who are you here to see? Because that's the most important thing. Who are you here to see? Or the second most frequently used phrase is insurance card photo ID, when in fact everyone should say, may I help you? Anything else I can do to help you? Right? When you're scheduling, anything else I can help you with? 99% of the time after the patient has had scheduled an appointment, they'll say, no, that's it, thank you very much. But not all of them do. They need to say, is there anything else I can help you with? And by the way, this reminds me, when you schedule a call, schedule an appointment with the receptionist or the call center, whatever, typically they answer the phone, ring, SuperCare Medical Group, this is Mary Beth, how can I help you? And I say, I'd like to make an appointment. And they'll say, okay, who's your doctor? And then you say, I don't have a doctor who's good. And one lady said, oh, I can't recommend any of the doctors at this practice. I thought that was a little scary. But anyway, what they should say is, I can help you with that. If I say, I'd like to make an appointment, that person should say, I can help you with that. Of course they can help me. That's the whole point. But they should say it so that I hear in my head when I am filling out the survey, helpfulness of the medical assistants and clerks, etc., receptionists, were they courteous and helpful? Every time you tell me that you want to help me, I remember that for the survey. And for the providers, from a seated position, because that implies that you're not rushed, what other questions can I answer for you? Not which is what some doctors do, which is questions, or the fellow that I shadowed Friday. Any questions? Just as if he couldn't be bothered. All right. This is, of course, a way to stop further questions. Most doctors are afraid that if they say any questions that people will ask them. This is one way to avoid that. Okay. Last but not least, reconnecting. First, with medical assistance. I told you, remember, reconnecting parts. But in addition, reconnect with the patient who is waiting in that exam room. Remember how important long waits in the exam room are in terms of if you do something about that, it improves your overall satisfaction and willingness to recommend. Simply have the medical assistant knock at the door, peek in, and say, "We haven't forgotten you. Dr. Jones is with another patient. She'll be here as soon as she can. Anything I can do to make you comfortable while you wait." That will boost your scores like you can't believe. Everybody, say something pleasant to the patient. And the most appropriate is not "have a good day." The most appropriate is "take care," because that's the last thing the patient hears as they prepare to depart. And that is that you care about me enough to ask me to take good care of myself. Well, let's, in the last minute here before we open it up for questions, let's just quickly review the service strategies that are clear. Connect, remember? And by the way, this is something that docs don't focus on. But studies show patients will like you. People in general, this goes for everybody. People will like you to the extent they believe you like them. Think about that. If I don't think you like me, I'm not particularly fond of you. But if I think you like me, I'm kind of, partial to you because, you recognize the qualities that I am. And the same thing, it's kind of a two-way street. If you think I like you, you're going to say to yourself, "Oh, she recognizes quality," and you tend to cotton to each other, as they say. So, connecting is a way to establish that rapport that says, "I like you as a person." How do you show that? By listening, and you show listening by looking at people in the eye and responding empathetically so they understand you know that you're both on the same wavelength. Explain. People want to know, how long is it going to be before I get the results? Or what's going to happen next? Where do I take my little cup to go pee in? Tell me these things. Don't just hand it to me and say the bathroom's down there. That's not enough. The bathroom's the third door on the left. What about ask? I wish I could see all of your faces. I would say, what's the most important question to ask? It is there anything I can do to help? May I help you? Anything else I can do to make you comfortable? Something that comes across as being helpful. And then, of course, reconnecting regularly with the patient who's in the exam room as well as the patient departs, saying that universally acceptable phrase, "take care." Well, having said all that, Steve, is it time to open it up for questions?
That would be great. And yes, this would be a great time if you'd like to ask a question. Simply press *6 on your phone and go ahead and ask your question at this time. Going once, going twice. Then I would like to...
Do we need to open up the lines for questions?
Yes.
Sure.
Oh, yeah. Sorry about that. Go ahead, Regina. My fault. Before you press *6, Regina, please press *43. Yeah, thank you for that. Now, if you'd like to ask a question, go ahead and press *6. Okay. Then let me pass the floor over to Regina. I know we've had a number of questions come in at info@healthsense.com. Regina, please go ahead and ask any of the questions that came in there.
Okay. There are a few. What is an acceptable wait time in reception and then also in the exam room?
That's a great question, and I always respond to it by saying, if you have a reservation in a restaurant, and the reservation is at 7 o'clock, and they say, please have a seat while we arrange your table, at what point do you get up and go to the maitre d' and say, how about my reservation? It's typically 15 minutes. Now, in the exam room, where you're really held captive, particularly if they've asked you to take off your clothes, time seems to go on and on and on because you're no longer in control. Or even if you have your clothes on, you're there by yourself, so you don't see any activity and you wonder what's happening. In that case, 10 minutes. But you can extend that 10 minutes if the medical assistant comes in and reassures you every 10 minutes that you haven't been forgotten. Because being forgotten is the person's biggest concern if they don't know what's happening outside those doors.
Thank you. That kind of leads actually to the second question here. It's interesting because you segued right into this. Do you see patients complaining about multiple people entering their room during a visit?
Only if those people who are entering their room are not part of their encounter. What's annoying to a patient is when he or she is with the physician or the provider, and then the nurse knocks at the door and then barges in with some information from the doctor on another patient and then leaves, and then subsequently comes back for something else. That's very annoying to patients. But if the people who are coming into the exam room are there to do an additional consult with the primary care doctor, let's say it's a specialist who comes in, or someone who comes in with specific information for the patient at the request of the doctor, let's say educational material, that's typically, I've never seen a patient get upset at that.
Then I have a follow-up question. Do you ever see patients, I know that they ask, this is just my own personal question following your answer there. Do you ever, I know that they ask, but I've had this happen to me where we're sitting in the exam room and the doctor walks in with a medical student. Do you have you ever encountered that, and what do patients think about that in general?
Usually it depends on how the doctor introduces the patient. And here I am, I'm a shadow coach, so I'm one of those people. I'm not a medical student, but I go in with the doctor, and typically the patient is not offended, particularly since the doctor, if the doctor does a good job. And if it's, hi, I'm Dr. Jones, and I have Steve Smith, he's studying to be a doctor. Would it be okay if he sat in on our visit today? Now, what's the biggest concern is to a patient is the level of sensitivity of the issue that they are there to discuss. Usually, when I am there as a mystery patient, I always say to patients, I leave during the intimate parts of the exam, so I am not there to witness or observe anybody who has to have a pap smear or a genital exam or any of that kind of stuff. But I've not seen, and let me back up to say that I shadowed a physician who also had medical students tagging along, and they always have to get permission, and permission was always granted.
Okay, Steve, I think you had a comment or question?
No, I just wanted to check in and see if there were any final questions as we're coming up on the top of the hour.
Okay, there was one more. Actually, two more, but we might be able to cover these kind of together.
I'll talk.
Go ahead.
I'll talk fast. Go ahead.
Okay. So the first one was that the first question and comment is that you talked early on about respect and perceived respect, and there seems to be kind of a gap between what doctors perceive as respectful behavior and what patients perceive as respectful behavior on their own part, both each individually and then toward each other. Do you have any tips to like bridge the gap or close the gap in perception?
Well, let me tell you that first, it's easy for doctors to show respect simply by paying attention to the patient and acknowledging the concerns and so forth, and making very, very small talk with the patient so the patient feels cared for as an individual. On the other side of the coin, it's a much harder task because doctors truly believe the patients don't respect them as they used to. Some doctors remember the old days when the doc was on a pedestal, and it certainly is not the case any longer. And so what doctors need to realize is that patients see them as mechanics rather than as saints. And the docs have to be more realistic. What most physicians are most frustrated by is that some patients believe that it's up to the doctor to provide a simple, easy cure that doesn't require any effort on the part of the patient. And the doctors, on the other hand, believe that patients should be taking responsibility for their own care. And that's the big gap. And many doctors wish that there was more education on for patients about what their responsibilities are.
Okay. And then the final question is, because so many of these measurements seem subjective, and the recent legislation that kind of took away the SGR, that there's what I've read is that there are a series of years where there are going to be slight increases in Medicare reimbursement, and these performance-based, I guess not penalties, but possibly penalties will kick in a few years down the road. Can you speak to that a little bit? What is the timeline? And do you know anything about how much increase is going to be provided over the next several years, and then how much decrease might be taken after these?
No, I am so sorry. That's not my area of expertise.
Okay.
But I know that 2017, I think, is the watershed year where all of this is going to apply to practices with fewer than 50 doctors.
Okay.
Right now it's I think 50 plus docs, even 100 plus docs, but 2017 I think is when it's going to be enacted for smaller practices.
Okay. Thank you very much. That's it. Steve?
Okay. Thank you, Meryl, and thank you, Regina, for the excellent questions here. As a wrap up here, I just want to remind the participants that to reach Quill Healthcare, the number's at the top of the page, and also to reach out to Regina or I, or for that matter, if you have any feedback for Meryl, please simply send it over to info@healthsense.com, and we will promptly convey your questions to the right person. And also, if you have an opportunity, we'd appreciate it if you would take a moment to go to www.healthsense.com/webinar survey to take a brief 2-minute or less survey. We don't believe in over surveying folks, so we don't give you, like an auto dealer survey of, 5 pages worth of questions, just 3 or 4 quick ones to get an idea and take your pulse relative to the value of the webinar and our guest speakers. And last but not least, for those of you who have attended for CEU credit, please allow for the next 2 to 3 business days by the end of the week in order for you to receive documentation from Deanna Wolf, who will be sending that documentation over to you based on the association that you are enrolled with. And if you have any questions about the CEU certification, feel free as well to reach out to Deanna. I want to thank Meryl once again for being our guest speaker and for conveying her insights relative to patient satisfaction and how to run a practice in a way that meets the needs of its customers, its patients. So Meryl, our thanks to you for sharing this useful information.
You're welcome.
I'd like to remind everybody that Quill Healthcare as well is there to answer all of your questions about healthcare products, including medical supply products and office supply products. With that, we are wrapping up the webinar, and I want to thank you for your participation. Have a great afternoon.